Hi everyone, this is Kate again. So thank you for your attendance this afternoon. We're going to get started. I am going to be recording this webinar for future reference. My name again is Kate Quigley. My information is up on the screen here, so if after the webinar today you have any questions about the website that we're going to show you or resource questions in general, you can always email or call me. Please feel free. And I would like to welcome my colleague who's joining me this afternoon. Her name is Laura Robideau, and she is our Coordinated Intake Housing Program Manager here at 211. So I'm very happy that she's joining us this afternoon. She's going to share a lot of great information with all of you about the housing process for individuals who are homeless here in Connecticut. So we'll hear from Laura in just a couple minutes. So we're going to get started. I'm going to go to our website here. For those of you who have never used our website before, the web address is www.211ct.org. And for those of you who have used our site before, but maybe not in a little while, we've had a lot of changes and enhancements to our website. So the look and feel of it will be a little bit different and hopefully vastly improved from the older versions of our website from the past. So today we're going to focus on housing resources. I do just want to give thanks to CHN and DSS for their support of this effort to provide these webinars for all of you. We appreciate your participation and interest in the topics. We have one more coming up next month, which you will get an invite about. We're going to focus that one on the state benefits assistance here in Connecticut. So just stay tuned for that one, and that will actually wrap up our series next month in January. For those of you that are unfamiliar with 211 in general, we are the state's 24-hour information and referral line for health and human services. We have been technically in existence for 40 years. We started off as InfoLine. We have grown and evolved from that point over the last 40 years. This year is actually our 40th year. We've been doing some celebrating. One of the things that was a very big task for us was the development and enhancement of our website. So with that, I'm going to jump right in. Just a couple of quick stats for you. In fiscal year 2016, the number of calls that came into 211 related to housing and shelter was 38,544. So it's always within the top 5 requested services when folks call into 211 needing help and information. I'm going to start by giving you the lay of the land of our homepage here. So we're going to do some searches in a few minutes, but I just want to scroll down actually to the very bottom of the list of the homepage. The first item I'm going to show you is our 211 Navigator. So this is a benefits screener that was actually built here in-house at the United Way of Connecticut. It's a very non-intimidating screener, and what I mean by that is you don't have to put in any Social Security information or birthdays. It's basically a very easy screener that will assess for some demographic information, details about your family, details about your household income, and then once you hit submit, what it does is it will deem eligibility for any one of these programs here, mostly state and federal programs. We have a few nonprofits listed on here. So this list, based on what you input, will be customized to you based on what you might qualify for. So if you're working with families and patients, this is a nice way to start the process of determining what programs they may or may not be eligible for. And I say, may not be eligible for because if you can clearly identify that this person is not eligible for a certain program, it would save them a lot of time going through the process of waiting in line or waiting on the phone and doing an application when really they might not qualify for that. So that's the Navigator from our homepage. Once you get your results, let's say the person was appearing to be qualified for food stamps, what you'll get is a few options, sometimes one, maybe more. The application is actually embedded right here. And then if we go back, there's also a quick informational sheet. We call these our e-library papers, which you'll see more of in a moment. But it will give you some information about the Food Stamp SNAP program, how to apply, some external links back to the State Department of Social Services, and then some links back into our database. This is kind of a longer paper for us, but it gives a lot of information, again, to just know where someone might stand up front if they would, in fact, qualify. Okay. I'm going to go back to our home page and back to the bottom. The second tool that we have also developed here in-house is the Housing Choice Voucher website. So you may know of Housing Choice Voucher Program, HCVP, otherwise known as Section 8. So related to housing, Section 8 is a program that is oftentimes difficult to come by, but housing authorities across Connecticut are required to post information to this site when they have an available opening for either an application or they have some Section 8 designated spaces available. The most important thing about this site that we always like to tell people about is the register for posting notifications right here at the top left. You, your patients, your clients, whomever you're working with, they can just very quickly plug in an email address, and then what will happen is every time something is posted to this site, you will get an alert through email, and it'll say there's a new post on the site, click here, check it out, and then you can, once you're on the site, view the actual postings that are listed. They're usually both in English, and as you can see from this one, also in Spanish. Okay, so this is a really important site to remember if you're working with low-income individuals who may need to sign up for and be more informed about this program. All right, so back to the home page, I'm going to quickly go to our e-library. So the tabs at the top here, if we click on e-library, we have a specific category for housing. And just a little bit of background, these papers were developed by the department that I'm currently working in, the Information Services Department. They were developed for our call center staff. So a little bit more information about certain programs, certain resources. They were eventually put onto our public websites. They get a lot of traffic. They're very informative. So for the sake of our demo today, we're going to click on the housing category. And we're going to look at the landlord-tenant's rights and responsibilities page. We always cite at the bottom where we get the information from. We do a kind of a quick snapshot of information. We like to keep these concise, a page or two. We have external links if you're looking at this electronically, but as you'll see, there is a PDF creator. If you felt like you were working with someone who really needed to know what their rights as a tenant was, you could make a PDF, print it for them, and send them on their way with some information. The benefit of looking at it electronically is that you will get links back, again, to external links, but also back into our database. I'm going to choose this one here, Landlord-Tenant Assistance. You're going to see the results list for all of Connecticut for resources that we have that relate to landlord-tenant assistance. Okay? We're going to jump into the database a little bit more intensely in a moment, so I'm going to just go back to the e-library one more time. And I just wanted to show the paper on heat complaints. This time of year, we often get a lot of calls from people who are tenants living in an apartment where the landlord is refusing to put the heat on. So this very short e-library paper explains that per state statute, the minimum temperature of an apartment or a home has to be 65 degrees. So if it's below that, it is illegal for a landlord to not provide heat to their tenants. There are some links with more information. A call to the local police department can occur, and they will enforce that the landlord turn the heat on. So we wanted to make all of you aware of that. If you're hearing of situations where people are living without heat, they definitely have rights in this situation, and certainly empower them to take the necessary steps for that. So I'm going to go to our home page again. Some of the search options for our website have been enhanced, and one of the enhancements that we have made is to provide people with some help statements or need statements. So right here in the middle where it says unsure of what you're looking for, let us help. If you click on let us help, you'll see a drop down. There's a few options here. We put these together based on the most common calls that we get into 211. So when our staff are answering the phone, this is how people are presenting themselves. I need housing, I need help preparing my taxes, I need someone to talk to, etc. The first one on the list I need a place to stay tonight, relates to the topic at hand today. So I'm going to choose that and click Continue. And then it's going to ask you for a location. If you don't put anything in, it will remain to serve all of Connecticut. So the resources will be a statewide list. But for the sake of today, we're going to put in East Hartford and then Continue. And we're going to see a list of combined resources, mostly homeless shelters that serve anyone in the East Hartford area. So you see quickly there's 15 resources. Before I turn it over to Laura, I'm just going to show you very quickly how you would look at a little bit more information about this particular entry at CRT East Hartford. Just clicking more details provides you with much more information, and Laura's going to speak to this in just a second. Let's just say that, you know, whatever you're looking at here, you come to find out that something in our record is incorrect. I just want to make you aware that from the website, and this can happen at any point from anyone in the general public, you can report an update to us right here from a resource card. So if you click that report update button, it's going to pre-fill it with the agency and the program you were looking at. Just tell us what's incorrect. That once you hit submit, it comes right to my unit, and we act on those very quickly because our database is very large. It's 4,000 agencies, 40,000 resources, but we're only as good as the information that's given to us by agencies, by folks in the community like yourselves, and just really from the general public. So don't forget that report update button. That helps us to keep everything as up to date as it possibly can be. I'm going to go back to the results list, and then I'm actually going to turn it over to Laura to talk a little bit more about the process for homeless individuals and families in Connecticut.
Sure. Thank you, Kate. Hi, everyone. My name is Laura Robidoux. I am, as Kate said, the Housing Program Manager here at 211. So I manage a team of staff and also help with the coordination efforts that the state has put in place regarding households, families, individuals in the state of Connecticut who are experiencing a housing-related crisis. I'm not sure how familiar all of you are with the new process that is put in place for folks seeking shelter or anyone experiencing a homeless-related crisis. But if a patient or a client of yours is looking for shelter or is presenting as needing to leave their home right away or within a certain amount of period, what you can direct them to do is to contact us here at 211. Back in 2014, the state started a phased implementation of what's known as CAN, which is the Coordinated Access Network. And that's really a network of community providers. It includes homeless shelters. It also includes other types of homeless service programs such as rapid rehousing, transitional housing, supportive housing. Because what had happened in the past is if someone was looking for those particular programs, they would contact each of those programs individually. Now with this new coordinated effort, someone would contact just one site, which would be 211. We serve as a front door access point, and they would get connected with a member of our housing team. They would dial 211, press option 3, and then option 1 to reach someone on our housing crisis line. And the housing specialist that answers that phone would do a brief assessment with our caller to determine exactly what their needs are. Is this someone who's doubled up that may be able to stay where they are, you know, for the time being and just need some help with subsidized housing or Section 8, which Kate and I will review a little bit more in depth with you on our website in a little bit. Or is this someone who really has no other options and needs to get into shelter as soon as possible or access some other type of homeless program? And so I mentioned that this initiative took place starting back in 2014, and really the intent of this is to help with ending chronic homelessness and ultimately trying to end all of homelessness for the state of Connecticut. Connecticut was actually the first state to end veteran chronic homelessness last year, and we were the second state in the country to end veteran homelessness last year. Currently, the state's focus for this year is to end chronic homelessness for individuals, and then looking in the next couple of years, the goal is really to end chronic family homelessness and really all around homelessness for folks. And this initiative really is led by the Department of Housing as well as CCEH, which is the Connecticut Coalition to End Homelessness. So our piece of the puzzle here is really to do that brief assessment with the callers in need. We work very closely with the community providers and those 2 state agencies. And when we speak with a client, after we do our assessment, if it's determined that we really can't divert them to any other resources and they really have no other options, we would do a brief intake with them over the phone. And what's involved in that is about a 5 to 10 minute conversation of getting some basic demographic information, trying to determine if there's other types of needs that the person may have related to substance abuse, mental health, any financial resources that a person may have. They need referrals to other things such as food, clothing, seat assistance, things like that. And then we would get them scheduled for an assessment appointment. And what that is a face-to-face interview, for lack of a better phrase, with a community provider. That community provider may be at a shelter or they may be at a town social services office. And that assessment appointment would take place at the local level. And what that does is it gives that client an opportunity to really talk more in depth at the local level with someone about their situation, and then that information from that assessment appointment is then brought to the larger CAN community to really determine what types of resources may be available for that person. If there is an immediate shelter need, then then that community provider may be able to connect them with shelter that day, or they may say that the shelter will be following up with them. But really the intent is to help stably house that individual. So that may be through one of those homeless programs, or it may be a referral to a security deposit program or to a Section 8 program or a low-income housing program. And so when you go onto our website, you may see when you search for shelter that it says this agency participates in a unified intake process. They need to call 211, and that's exactly why. Callers can no longer contact shelters directly. They would be directed to contact 211 so that we can really go through and see if there's any other options to avoid them becoming homeless in the first place, and then as needed, refer them to the local community providers for that assessment appointment. There are, just so you have a little bit more background, there's 8 CANs throughout the state, and again, CAN is the Coordinated Access Network, so the state's broken up into 8 different networks of these homeless programs and a homeless service provider. So depending on where a person is or where they're ultimately trying to be, the folks here at 211 would register them into the appropriate Coordinated Access Network for that assessment appointment and to receive any follow-up services that may be needed. And so if you look here, there is, Kate is mentioning up top the warming centers and the cold weather information. And given the severe weather that we are expected to have the next couple of nights, the governor has declared that we are activated for severe cold weather. And so what that means is regardless of shelter availability, anyone in the state of Connecticut who is needing shelter is to be housed, and that could be a referral to an overflow shelter. That may also be a referral to a warming center. On our 211 website, you'll see that there is a listing of warming centers. Some of them are specifically open during daytime hours. Others may be open during the overnight period. Our information department is working very closely with different town providers. I'm also working very closely with the shelters to make sure that this information is as up to date as possible. If you are working with a client and you're not seeing a resource in their community, please direct them to call 211, because again, what we can do is we can get them registered for that CAN appointment and do an assessment with them over the phone, and then we can also do some follow-up to see if there are additional resources that are in the works that we may be able to refer them to, or we may be able to follow up with them, within a short period of time to make sure that they are going to have a safe place for the evening. And Kate, I'm not sure if there's anything more you wanted to add to this.
Yeah, I think that, and thanks, Laura. This page is something that, like Laura said, when we're activated by the state, we will put a page like this or something similar based on the event or the weather situation. We'll put that as the banner from our homepage for easier access. So you can always stay looking for that at the very top of the page, and you can get the most current information that we have as it comes in. So I think because it's very timely today that it's very cold, so it was good that we had the opportunity to show you that, but we've done this in the past for, hurricanes and the like. So I think we'll do maybe just one or two more searches because we only have a few more moments here and we would like to save the last few minutes for questions. So I'm just going to type in here to show you the functionality of the site really quickly, and those of you that have tuned in before for past webinars, you probably know some of this, but I'm going to choose low-income subsidized private rental housing, and I'm going to narrow it down by New Haven and click search. There's a fair amount of resources here, 50 resources altogether. Very quickly, let's just say you were working with someone and you knew that they wanted this particular entry. You could print this or share this individual resource card. So printing is always an option. Sharing one card has two choices. You can text it or you can email it. The other new feature about our site, though, is that you can build up a resource cart of information. So let's say the person you're working with likes a few of these options. They want to call. They want to see if these particular sites are accepting applications. You can start to build up your cart here. As you see at the bottom, it's jumping up in numbers. When you choose your resource cart, you'll see what you've put in, and you can remove any that you might have changed your mind about, but you can also print this full list, or you can email it. So the only thing that's lacking from the cart is you can't text the whole cart quite yet. We just don't have the capability, but emailing and printing are always options, and it's a nice way to keep yourself and whomever you might be working with organized with the resources that they're needing. This is a single session use. I always just like to caution people on that. So if you build a cart, do something with it. Print it or email it, because if you close your browser, the cart goes away. We're all used to shopping carts out in the internet there. Ours is free. You don't have to pay anything for it. Just back to the resources here really quickly, we do have some new filtering capabilities. So this search is a big one of 50. Let's say we wanted to narrow that down because you're working just with a family. So if we choose family and filter these results, the list will be narrowed from 50 to now 26. So a little bit more manageable, and again, you can go from there by building up your cart, looking at the details. There's some suggested terms that also come up for you on every single search. So we do encourage you to take some time to kind of play around on the website and see what you might find that suits the needs of the person that you're working with. We also list the domestic violence shelters in the database. I'll just show you those quickly. I'll keep New Haven just for the sake of time. So the option in New Haven is the Umbrella Center. So they have two sites, one in North Haven and one in Ansonia. But I would just like you to see here the central intake line statewide is this 888-774-2900. From anywhere in Connecticut, if someone dialed this number, it will route them to the local domestic violence service in their area. So that's an important number to know. It is answered 24 hours a day. So if anyone is in that situation, they can be, their call will be handled very, very quickly. The last search I would just like to show, and Laura, if you need to chime in or want to chime in, please feel free. I'm going to look up youth shelter. So the actual term is runaway youth shelter. I'm going to do a statewide search for this one very quickly. And 14 resources statewide, so if you needed to narrow that down. These are important to know as well because they do cater specifically to different age groups of youth, but generally it's 11 to 18, some go a little bit higher, but we do know that this is a big need to have these resources available for these kids who need this type of safety and this type of an environment. Yeah. One more and then we'll take questions and then we'll wrap it up. I'm just going to show you the maternity homes. There aren't a lot across the state, but there are some. So if you're working with either a young woman or an adult who is pregnant, there are a few options. This is just a different type of housing option. It's more transitional and supervised. They usually have to abide by, house rules and guidelines in terms of educational opportunities, case management, support groups, counseling, things like that. But it's just another housing option to consider and remember if that suits the bill of someone's situation. Okay, I'm going to pause for just a second. I'm going to go back into the software. If you have a question, I invite you now to go ahead and type that in. We have about a minute. We can go over a minute or two unless you have to log out. But if you have a question, please go ahead and type it in. I'll come back on the phone in just a quick second. Okay. All right, so it looks like there aren't many questions, but I appreciate the nice, kind, positive feedback. Thank you all for tuning in. It was our pleasure to talk to you this morning. Oh, looks like we do have a question here. In the past, I've been on the phone holding upwards of 45 minutes. Has this been resolved?
So I will speak to that. If you are calling in with someone who is currently homeless or who is facing that housing type crisis, it's really important that when they call in, they go through our housing crisis line, which again is option 3 and then option 1, and then waiting on the line. If you press any additional buttons, then more than likely what it'll do is it'll bring you to our more of our informational queue, which is not a prioritized queue. Our informational queues, all of our 211 informational queues, do give the option for a callback because we do realize that that sometimes there can be a lengthy wait time. But if you come in on any of our crisis lines, which would be for mobile crisis, for a regular 211 crisis, or for a housing crisis, which the verbiage on there says if you need immediate shelter, please wait on the line after pressing 3 and 1. Those are queues that we are very closely monitoring. And those calls are answered. In a prioritized manner. And so, if there are any other questions or concerns, Kate's information was on there, and she can certainly forward those on to me or to anyone else within the 211 Contact Center leadership team for follow-up. Thanks, Laura, and thank you, Maria, for the question. If anybody else has a question, I'll just keep it open for one more minute, and then I'll put my contact info back up one last time. Thank you all again, and we hope that you stay warm and have a wonderful holiday. I'm going to put my contact info up one more time. Please feel free to reach out by email or phone anytime, and if it is, like Laura said, housing specific or specific to any other department here, I'm happy to forward things along and bring up any questions or concerns that you may have. Okay? All right. So again, thank you very much. I'm going to close down the webinar. It was lovely to speak to everybody today, and we'll talk soon. Thank you. Thank you.